Good evening, everyone. Good evening, Gida ma'am.
Good evening.
Thank you, ma'am, for joining. Dear delegates, we'll start the session at sharp 3:30 p.m. Kindly wait.
ഞാൻ കോളേജിൽ ചെയ്യിപ്പിച്ചത്
நானும் அனுப்பல. அப்ப உங்க அம்மா ரொம்ப கலகல் இருக்கிறாங்க. நீ இப்படி இருக்கிற. நான் எத்தனை டைம் சொல்றது ஃபேன்.
Hello, am I audible?
Yes, Dora, you are audible.
So let's start. A very warm greetings to each and everyone. It gives me an immense pleasure to extend a very warm welcome on behalf of Jyoti College of Management and Technology, Changanacherry, Kerala. Jyoti College of Management and Technology, Changanacherry, affiliated to Mahatma Gandhi University and approved by All India Council for Educational Technology (AICTE) New Delhi, was established in the year 2002. It is known for its commitment to academic excellence and both personal and professional development of its students. All the delegates are requested to mute your mic.
Supervisor.
I am Jara Devi, the MC of the event. On behalf of the organizing committee, we extend our appreciation for your valuable presence today. In colleges, faculty development programs are conducted to enhance the academic and intellectual environment of educational institutions by providing the faculty members the right direction to pursue research and partake in seminars and workshops. Today's session will be handled by Dr. Geeta Singh, Assistant Professor of Amity Institute of Behavioral and Allied Science, Lucknow. The topic for today's session is Strength in Neuropsychological Rehabilitation. Now, we are about to move on to our session. Before we begin, I would like to remind certain things regarding FDP. The program will be recorded and live streaming will be available on our YouTube channel. So, participants who couldn't join the Zoom meeting can listen to the YouTube streaming. You can ask any query to the resource person by using the Q&A feature at the end of the session. Delegates are requested to kindly wait till the end of the session. Feedback forms will be provided at the end of the session. Please make sure that the feedback forms of all 5 days should be filled in order to get certificates. Out of 5 sessions, all compulsory attendance of remaining 4 sessions to be ensured for getting the participation for certificate. Now I invite today's moderator, Ms. Charan Jose, to introduce our distinguished resource person. Over to you, ma'am.
Thank you, Dora, for the warm welcome. Dear delegates, welcome to the second day of the online faculty development program organized by the Kristu College of Management and Technology, Changanacherry, on the topic Evolving Patterns in the Field of Psychology. It's my absolute pleasure to introduce the guest resource person for the day. We have with us Dr. Geeta Singh, Assistant Professor and Registered Clinical Psychologist from the Amity Institute of Behavioral Health and Allied Sciences, Noida, India. Dr. Geeta Singh has completed her doctoral degree in clinical psychology from Onde Institute of Medical Sciences, New Delhi. She completed her MPhil in clinical psychology from Central Institute of Psychiatry, Ranchi. She did her bachelor's and master's from the University of Lucknow. Dr. Geeta has worked as clinical psychologist for a 1-year research project funded by Indian Council of Medical Research, Delhi, and also with YMNA Association, Disha De-Addiction Camp Rehabilitation Center, Lucknow. Dr. Geeta Singh has received numerous awards and recognitions. She is the recipient of the International Travel Grant Award to the 14th International Congress of Behavioral Medicine, Australia. She's also the recipient of the UGC Net ARF Award by the Ministry of Human Resource Development. She has also received numerous recognition for the Best Oral Paper Awards and Best Poster Awards. She has also presented research articles in many conferences and symposiums in both India and abroad. She has on her record publications in journals, including Indian Journal of Psychology and Medicine, Asian Journal of Psychiatry, and International Journal of Indian Psychology. In addition to the expertise in the academic field, she is also a well-renowned author for the various books in the domain of psychology. She has also submitted WHO reports to identify mental health issues and provide help to the disaster management professionals to improve their mental health. Dr. Geeta Singh was also the invited speaker for Women Mental Health by UN Women Lucknow and also for Maternal Mental Health by Girl UP Lucknow, a UN campaign. She has attended numerous seminars and conferences and also did her internships and workshops from various prestigious institutes. Dr. Geeta Singh, I consider it as my absolute privilege and honor to have you as our resource person for today's session on trends in neuropsychological rehabilitation. Thank you, Banner. Over to you.
Thank you. Thank you so much, Sharon, for the wonderful introduction. And I'm very thankful and I congratulate to the, Kristu Jyoti College for organizing this FDP on such a very relevant topic. So just give me a moment. I'll share the PPT. Is it visible?
Yes, ma'am. It's working perfectly.
Okay. Okay. So I'm here to talk about the trends in neuropsychological rehabilitation. But before we talk about neuropsychological rehabilitation, about its trends, first it is important that what is the significance of teaching the basic neuropsychology or neuroscience paper to our PG students, and what are the relevance of teaching the biological foundations of behavior to our students, because the more we'll apply the connect the theoretical frameworks work or the theory with the practical usefulness of the information, the better learning will definitely will take place among our students. So it is always important to tell them about all the practical significance and usefulness of the information. So why it is important to understand the brain physiology, the nature, and different functions of our nervous system. So suppose if a case of head injury in a road traffic accident, it comes to a psychologist for any kind of non-pharmacological management, or you can say psychological management. So what should be the line of management, especially from a psychosocial perspective? These are some relevant questions that can be answered by a psychologist only. And we should be even, the learning should take place in a way so that a psychology student would be able to understand the relevance and all the significance of learning these concepts.
All the delegates are requested to mute your mic.
So before talking about this thing, it is important to understand that neuropsychology.
Dear participants, we request all of you to kindly mute your mic so that the session will move on smoothly. Thank you.
Okay. So it is important to understand that neuropsychological assessment and neuropsychological rehabilitation are basically the two branches of clinical psychology, which is also known as clinical neuropsychology. And whenever there is any kind of damage to the brain, and there can be so many factors or reasons for that damage that can lead to the need for neuropsychological rehabilitation. So when we talk about our brain, so we all know that our brain is our chief organ, and it controls all the bodily functions. And if there would be any kind of damage to the brain, that can lead to the mortality or death of the individual, and can also lead to the morbidities. Morbidities, that means the psychological consequence, the physical consequence, or the psychological consequence of the damage to the brain. So whenever there is any kind of physical damage or physical disability, here comes the role of medical professionals, the physiotherapists, the doctors, and even the speech therapists to manage the situation. But whenever there is any kind of psychological damage or psychological morbidity, here basically the role of psychology professionals can be emphasized. So whenever we say psychological can be basically categorized into the two domains of individual or in terms of family or society. So when we say individual consequences, it can be the cognitive, there can be the cognitive impairment because of the damage to the brain. Cognitive impairment, that means the impairment in terms of memory dysfunction or any kind of problem in problem solving related issue, decision making related issues, or there can be the problem in executive functioning, attention and concentration problem related things can take place. And there can also be the emotional changes, behavioral changes, and social changes within the individual. So it is not that the damage only impacts the brain function or higher, but it also impacts the emotional, the personality, our motivational level, and there are so many things that can be impacted because of damage to the brain. And on the other side, it can also impact the family or society, because whenever there is any case of head injury and all in your family, definitely it is going to be a burden on the family. So burden can be financial, burden can be emotional or psychological. So overall it is going to impact the society. So here comes the role of psychology professional, which I'll basically talk about, not on in terms of physical damage or physical disability that I'm going to talk. So whenever there is physical disability or damage, there comes the role of neuro rehabilitation. But when it is psychological, here comes the role of neuropsychological rehabilitation. So overall, the work or management work is the teamwork. Teamwork means there would be the work of doctors also, speech therapist also, if there is any problem in the communication, speech related issues are there, and that has some physiological base, not psychological. There would be the role of occupational therapist, physiotherapist, and obviously the psychologist. So overall, the main or basic goal of neuropsychological rehabilitation remains to restore the functional abilities of the individual, so that one can live or reach to the pre-morbid level of functioning. And when we teach these kind of cognitive dysfunction or functioning, that should be generalized to the everyday life. So, and if in case the primary goal is not possible, then there should be emphasis on the secondary goal. So at least to improve the functions to certain extent, or at least to some extent, so that one can live their life in a very productive way, or in an independent way. And suppose if the case is very severe and injury is severe, in that case we also have to use the tertiary goal. Tertiary is basically all about to providing the cognitive aids to the individual, so that there would be less burden on the family member or on the support system of the individual. So these three are basic goals of neuropsychological rehabilitation, so that one can live their life in an optimal way, and can live their life with full of independence without any help. So when we talk about the neuropsychological rehabilitation, obviously there should be any kind of damage to the brain, but it is not necessary that damage would be always related to the accident and all. So apart from brain injury, the cases of stroke, tumor, epilepsy, degenerative conditions such as dementia and all, there also, and even in psychiatric disorders, the role of neuropsychological rehabilitation takes place. Because when we talk about neuropsychological rehabilitation, in, for example, in schizophrenia, generally after the chronic nature of illness, after a certain period of time, the cognitive decline takes place. So there also we go for cognitive retraining. Even in the case of ADHD, we can see that there are so many neuropsychological deficits are there, attention related issues are there. So in that condition also cognitive retraining can be applied. And also in the case of substance use disorder, because chronic use of any kind of substance also leads to the need of, or leads to the different kind of cognitive decline, or cognitive impairment in the individual. So there also the role of neuropsychological rehabilitation takes place. But before we talk about all these concepts of neuropsychological, what is the process, or what is the mechanism through which the change takes place? So overall, what is the foundation of this neuropsychological rehabilitation? So overall, the entire process and the entire mechanism of rehabilitation, especially neuropsychological, especially the cognitive rehabilitation, that depends upon the fact of brain plasticity. So when we say brain plasticity, our brain has a capacity to adapt to the changes which can be because of the internal demand or external environmental demands. So change also takes place in the brain structure. So if you bring a short-term modifications in the function of in the individual's life, there can be the long-term structural changes in the brain. So this is the whole concept on which the neuropsychological rehabilitation is based. And what is the mechanism through which this plasticity works? So first we have to understand the regeneration, reorganization, recovery. These three are the processes through which plasticity works. When we talk about regeneration, generally we think, or our usual understanding is, that regeneration of neurons do not take place, but that is not completely right. Yes, it is right to certain extent. Our neuron, it depends upon which particular part of the neuron is damaged. Suppose if the axon is damaged but the cell body is intact, in that case regeneration of neuron can take place. But if in the case of where cell body is damaged, so definitely the regeneration is not going to take place. Similarly, the reorganization and recovery takes place where the damaged cells compensate for the functioning of or undamaged cells compensate for the functioning of damaged cell. So this is the whole concept through which the brain plasticity works. Now the entire concept, there are three approaches through which the process of rehabilitation takes place. One is about restitution. So restitution is all about our primary goal of rehabilitation, which I have just now discussed. It is all about the process of restoring the functioning to the pre-morbid level of functioning of the individual. And this is achieved through the process of cognitive exercises. So we apply several cognitive exercises depending upon what is the area which is basically impaired within the individual. So targeting that particular area, particular exercises are used. So this is the process of restoration. So there are certain techniques for improving the memory strategy, memory. For there are different for attention and concentration. So depend upon which particular area or which particular functioning is impaired, accordingly the restoration processes or the cognitive exercises are used. Second is all about substitution, which basically takes whenever there is physical disability is there, not psychological, where the replacement of impaired function that is replaced by the alternative strategies. And then the role of compensation, which is our third goal of tertiary goal of neuropsychological rehabilitation. It is about providing the cognitive aids which can make the life of individual very easy or independent. So when we say the cognitive aids, these aids can be in the form of visual cues that we can provide. Suppose if a person has problem in locating the where is the washroom in the home, so we can provide the navigation, or we can label with the certain directions for the individual, that this is the direction for going to the washroom and this is the direction for the kitchen and all. So written instruction can be provided, memory books can be given. We can also provide them with watches, beepers, or electronic devices, specifically to trigger particular behavior. So all these things, so there are restitution, there is substitution, and there is compensation. All these things can work together to bring the change within the individual in terms of their cognitive, functioning. Now, neuropsychological assessment is important element of neuropsychological rehabilitation. So when we know that this case has come to me for the rehabilitation process, before that we have to do the complete and comprehensive assessment of the individual. So there are so many batteries which give a very comprehensive picture of the individual in terms of what are the cognitive functions which are impaired, and even about the localization and lateralization also. So most commonly used tests, especially which we use in our medical setups, are NIMHANS battery and Ames battery. So, but when we consider for neuropsychological assessment, we also have to understand that there are several aspects that we need to consider before choosing for any kind of, while selecting any kind of assessment tool. So there is obviously the role of gender. Even the researchers state that gender makes a lot of difference on the assessment finding. And females are obviously very good in the tests which are basically verbal, and males are not comparatively. And even if we see in terms of the normal aging process, generally the cognitive decline has been seen more in male gender than in female gender. So there is definitely a difference in terms of gender. There is also obviously the impact of age, the impact of culture, and the background of the individual. What are the items are there in the assessment tool that makes a lot of difference. There should be obviously the role of education in the neuropsychological assessment process, and the substance use disorder, the history of substance use disorder, because as I already mentioned, the chronic substance use can also bring the change in the neuropsychological functioning. So all these factors can be considered while you're planning for the, or while selecting any kind of assessment tool. So, and similarly, the course of intervention, that also depends upon the diagnosis of the patient, age of the patient, and education, and obviously the pre-morbid functioning, because entire process of even restoration is dependent upon the that we try to restore the functioning of the individual to the level of pre-morbid functioning. So this is something which we need to know while planning for the intervention. Now, when we talk about the entire concept of management, principle, and practice, so approach should be obviously holistic. So we should, when we say the therapeutic, context, so it is, we should always, as a therapist, should provide the environment which is very trustworthy, in which there is cooperation, sense of safety and security. The environment should be pleasant, not stressful, and there should be, complete resources, physical resources in the environment, and the social environment should also be very supportive. The activities which we use should be very structured. There should be a particular timetable for each and everything, because the patient with whom we are dealing, those are already going through a lot of cognitive deficits. So everything, if provided in a very structured way in a particular time frame, so that would be more beneficial. And obviously the respect and collaborative working environment is must for any kind of intervention. So apart from that, when we talk about the second thing, which is very important, whenever we plan any kind of neuropsychological rehabilitation, the focus should not be only, for assessment of the area which are impaired, whether it is, psychological, physical, or cognitive, but we should also emphasize on the area which are intact, because intact thing or intact area that can be utilized in the management process. Even the entire management, entire prognosis, everything would be changed based on what are the factors, or what are the positive things are there in the personality or in the life of an individual. So whenever there is any kind, if we see the overall model of how everything works all together, so whenever there is any kind of brain damage, head injury and all, that can take the role of or the consequences can be physical, in terms of physical disability. For example, speech and communication related issue can be there. There can be limb movement related things. There can be issue of psychological dysfunction. So when we say psychological function disturbance, that can be in the form of depression, anxiety, low motivation level, impulsivity, complete personality change. Even if we go by our diagnostic system, ICD, we can see there are so many things that takes place after the damage to the brain. So there can be organic mood disorder, organic personality change. So all these things can be there because of damage or insult to the brain. And there can also be change in the higher mental function or cognitive functions of the individual. So these changes can be in the form of memory impairment, attention and concentration related issues, in terms of executive dysfunction, in terms of problem solving, in terms of decision making. All these things can be there. And all these function, our cognitive function, psychological function, the physical disability, we all know that our mind and body are interconnected with each other. So these all impact each other in a two-way fashion. And overall, the dysfunction in cognitive abilities, psychological dysfunction, and the physical disability all can impact our functional abilities, or functional consequences can be there. Functional consequences in terms of there can be impairment in the social interaction, there can be poor self-care, there can be uh, inability to work properly, or if someone is in academic, there can be a poor academic performance, poor occupational uh, performance can be there. So all these things can be there. Functional disability can be there because of impairment in cognitive, psychological or physical area. And there also comes the role of insight and a sense of loss. So if I'm aware about my condition, that there is depression, this depression is taking place, or my mood fluctuation is because of this and that thing, or because of damage to the brain, definitely that is going to impact my functional ability in a more severe way. Similarly, if I get this sense of loss, definitely it is again going to reinforce or increase the symptoms of my depression. But apart from all these, we also need to understand the area of family and social functioning. So which kind of family environment is there in the individual's life who has the brain damage? Whether the family is very supportive in terms of, also financial support, the psychological support, the emotional support, whether that is there is or not. Because if these are there, then that works as good prognostic factor for the individual. The management would be better. But if that is not there, absence of that can definitely reflect the poor prognosis. And also about the pre-morbid personality. So before damage to the brain, what was the functioning level of the individual? How was the personality of the individual? That matters a lot. And keeping that thing in a mind, we plan our management. So now if you see a case of head injury, and there is definitely a medical diagnosis for that, and after all the medical intensive treatment, that patient is referred for psychological management. And there is there are so many chief complaints of, for example, poor decision making, or not listening to the advices, or the person now after that damage to the brain has become very low, or has become very slow at doing the things, and even forget the small things. And whenever he is reminded about all these things, he becomes very self-critical and depressed. And irritability is also has become his main feature of illness. So So in these conditions, if someone comes to you, definitely you have to take the overall assessment of the individual. When we say assessment, first thing, what is important is that taking the detailed case history of the individual. So from where the problem has started, each and everything, how it all has started and what are the consequences in which particular areas it is there. We also need to know the pre-morbid personality. We also need to know the coping resources of the individual, which kind of coping, whether positive, negative, and whatever coping mechanism, because we people also use the, as coping mechanism, different kind of substances, for example, alcohol and all. So if it is there, definitely that is going to make the management process even more challenging. So what are the coping strategies one is using? That is also important. Role of environmental conditions, as I mentioned earlier, whether it is supportive or not, what kind of family environment is there. Apart from that, the mood symptoms, whether there is any mood symptoms or not. If it is there, which kind of mood symptoms are there, whether it is towards, depression or manic features are there. Because based on the nature of mood symptoms and nature of all the psychopathology, the management will obviously differ. And most important, the cognitive assessment, where what are the cognitive areas of decline or deficit that would be assessed. So all the activities or that should be which we plan for the management, that should be goal directed and obviously with the mutual agreement with the patient. So obviously always the goal should be smart. Smart means it should be specific, measurable, achievable, and relevant to the patient's aim or goal, and there should be particular time frame for that. So the thing should be structured. So when we say measurable or achievable, these all are also important from the perspective of research. So there should be particular tool or particular method to assess the change or assess the what is the intensity of particular behavior or particular symptom of the illness. And when we select, most important thing, whenever we select the intervention program, it should be evidence based. So when we say evidence based, there are different level of evidence, and the most and first level of evidence is your meta-analysis or systematic reviews. So if it indicates that this particular therapy or this particular management approach is beneficial for this particular symptoms or this particular illness, so that should be given priority. So overall, as I mentioned, it should be holistic. So the role of occupational therapists, speech therapists, physiotherapists, all comes, and also the cognitive retraining through the use of cognitive exercises. The environmental modification should be there. That I'll discuss here. Individual psychotherapy and family involvement is must while planning for the management. So individual psychotherapy, here the mindfulness, social skill training, if there is any kind of social skill deficit is there after damage to the brain, if there is any problem in the coping abilities, that should be there. And because family also go through so many stress and all because of the problem with the individual, then definitely there should be provision to the provision for providing the family counseling sessions. And another important thing, because neuropsychological rehabilitation cannot be done only by the therapist, so involving the family member also in the treatment process is very important, because through them only the cognitive training or cognitive exercises which we are teaching to the client or individual, that can be generalized to the natural setting of home or any other area. So these cognitive retraining or exercises can be paper pencil based, or these also can be computer based. So as I mentioned earlier, depending upon the area of deficit, for example, if there is problem in the attention, so digit cancellation task can be there. If number connection tasks are also there that can be provided in case of attention deficit is there. Especially again, for if there is problem in the mental speed, then digit coding test to speed up their process, grain sorting test. One thing which is very important to know, that whenever we conduct any kind of neuropsychological rehabilitation, we have to increase the complexity level of these tasks gradually, in a very gradual manner. So it will start from the easy task, and gradually the complexity would be increased of these tasks. And for working memory, the sequencing of jumbled letters and all that can be done. Now, for planning or executive functions, there are maze completion tests that can be applied for the neuropsychological rehabilitation process, or short essay writing can be done. And even the role of behavior modification also takes place for modifying the different function, especially for executive dysfunction. So if someone has problem in making tea, so we can divide the whole task. This is called task analysis, the whole task in a very smaller steps, and for performing each and every steps in a proper way, in an adequate way, so the reinforcement can be provided to the individual. So behavior modification can also be applied. So there are so many strategies and these differ depending upon the which kind of deficits are there. And as I already mentioned, environmental modification. So obviously it depends upon the process of compensation. So written reminders or the cues can be posted for home management tasks, such as, for example, for grooming routine. So that can be posted on the, or we can paste or label on the bathroom mirror. For specific menus for specific meals, that can be pasted on the refrigerator. So these kind of activities or things can be done for compensating for the things that cannot be done using the restoration process. And for different kind of personality dysfunction or mood symptoms, as we all know that there are cognitive structuring that can be applied if there is any kind of cognitive dysfunction or cognition is there. So suppose if generally we have seen that in these kind of patient, they also start blaming themselves for all the issues going on in their life, and a lot of dysfunction cognition, such as I'm a loser, I'm not good at anything, I'm not good enough. All these things can be there. So to modify these cognition, the cognitive restructuring can be used for controlling the impulsivity, stop and think kind of activities or exercises can be used. Now there are few new trends, and there are so many researchers are also going on in this area, that is virtual reality based therapies. So as we all know, especially in a country like us, where obviously the ratio is very poor between the how many therapists are there and the number of patients. So the VR based therapy or virtual reality based therapy, these are basically based on the computer simulation. So everything through the computer based system can be done, and these are obviously time and cost effective. So if someone wants to perform on a particular task of how to make tea, for example, so all these things, such as as we do in the video game like activities, that can be performed. So these are efficacious management process for the management of various cognitive deficits. Then there is also EEG neurofeedback training. So this is basically to modify the brain waves using the operational conditioning method, and used for basically to memory and learning improvement. And this is also available, and there are so many researchers on that. Now this robotic assisted gait training, but it is basically to manage the physical disability, not the psychological one. And brain function therapy, and there are so many different therapy. For example, neurocognitive exercises are there, neurocognitive enhancement therapy is there. These all are the packages which can be implemented to modify the cognitive deficits of the individual in a very systematic, structured way. So this brain focused function therapy that is given by Professor Mukundan, and obviously in the stepwise function process, the task demand is increased and the restoration takes place. So this was all from my side, and thank you so much for the patient listening.
Thank you so much, ma'am. It was really an informative session. Participants are now free to ask questions regarding the topic to a resource person in the chat box.
Ma'am, it is from Tanya. May I know more on new management or sleep issues and psychological perspectives apart from CBT? We have a question from Mr. Tanya. Am I audible?
Ma'am, can you please repeat the question?
Am I audible? Can you hear me?
Sharing, your voice was not very clear. There is one question in the chat box that I can see. This question is all about the new management or sleep issues in psychological perspective apart from CBT. Okay. So obviously, apart from CBT, there are definitely approaches. Sleep hygiene is there, which is the most impactful strategy. Apart from CBT, there is also mindfulness-based intervention that can be used for the management of sleep disorders. There is, stimulus control sleep and sleep hygiene, as I already mentioned, for the management of sleep-related issues. Any other question?
Ma'am, we have another question. It's from Meenakshi. Am I audible? Can you hear me, ma'am?
Yes, I can hear you, Sharon.
Yeah, okay. So this question is from Meenakshi. What are the various methods in neuropsychological rehabilitation?
So as I already mentioned, the neuropsychological rehabilitation is basically based on the holistic approach. So there are so many depending upon which particular area has deficits. So if definitely there would be cognitive deficits, for that there are different approaches based on which particular cognitive function is disturbed. Apart from that, if there would be behavioral issues, psychological issue, social issue, for that CBT, behavior modification, that can be applied depending upon the symptoms or psychopathology of the individual.
Do we have any other questions? Yes. Ma'am, we are receiving other questions. It's from Jeffin. How can we handle the people who misinterpreted the neurological issue as a negative evil power?
Okay, so this is something related to the cognitive restructuring process. So on what basis someone has concluded that it is because of negative evil power? So this kind of from where all these are coming, these misconceptions are coming, and if it is there, there are different the ways how to handle. If there is any evidence to think in this particular way, so we can use the evidence generation technique of CBT, so to get the alternative perspective on the same.
Thank you, ma'am. We have other questions as well. It's from Nisha MS. Thank you for the insight on different methods of rehabilitation. Can you give guidance on the access of such interventions? Like where can we get trainings on these?
So definitely NIMHANS provide training on the same. There is also online material available on the same. You can also note down the name of few management techniques. For example, neurocognitive enhancement exercises that can be used. Even you can customize your own intervention package depending upon the need of the individual. So that can be tailored as per the need of the patient. So definitely those are there. Function therapy is there. That is also available online. You can go and check. Then application of brain plasticity.
Brain plasticity.
So brain plasticity is basically the foundation, as I mentioned earlier. It is the foundation of neuropsychological rehabilitation. So if there is no concept of brain plasticity, so definitely the process of neuropsychological rehabilitation is not going to take place. So entire concept is dependent upon the process of brain plasticity. That means if we do, certain functional or bring the certain functional changes in an individual's life, then there can be the change in the brain structure of the individual. Definitely that can take place. So this is the entire concept on which the rehabilitation process depends.
All right. Next question we have from Leah Medi. Could you please explain about substitution? I remember it being said as a replacement of impaired function by alternate strategy. What would they be?
As I mentioned earlier, definitely it doesn't come majorly in the scope of psychological management. It comes under the scope of physical. So if there is one physical disability, for example, in terms of blindness, so what are the other things? So other sense which works, if we see the natural process given us by the God, so our different sense of, for example, smell that starts compensating for the blindness. So all these things are there. So this is basically for the from the perspective of physical disability, not the psychological one.
All right, ma'am. We have two more questions. The next question is from Jeeva Nainan. What are the behavioral approaches in neuropsychological rehabilitation?
So this also I mentioned that behavior modification plan can be applied. So if there is cognitive or executive dysfunction is there, so the techniques of shaping, chaining, or reinforcement or prompts can be given to the individual for the rehabilitation of deficits.
Yes. Ma'am, I believe this is the final question. It is from Fatima Baji. What is the state of neuropsychological rehabilitation in India, the current scenario?
So generally, all the clinical psychology professionals, those who are registered with the Rehabilitation Council of India, they definitely provide the neuropsychological rehabilitation to the individuals, but the status is still the rate of referral for the neuropsychological rehabilitation process is very, very poor. And majorly still now still in current time, patients are referred for the diagnosis, for the assessment, but not for the rehabilitation. So obviously the status is not very positive. So ratio, there is much more need, much more requirement, but the in which ratio it is we are providing it to the patients or individuals, that is not that much adequate. That's true.
Thank you, ma'am. I believe there are no more questions.
Yes.
Feedback forms are provided in the chat box. Please fill up the form. Now I invite Ms. Sharon Jones to deliver the words of gratitude.
All right. I would like to express my deepest gratitude to Dr. Geeta Singh. Thank you, ma'am, for gracing the session by delivering such an informative talk on the topic of immense significance. I'm sure the delegates had a very enriching session. So on behalf of the Postgraduate Department of Psychology of Kristu, the College of Management and Technology, and all the delegates present here, I express my deep gratitude and appreciation for sparing your valuable time for us. Thank you so much, Matt. We are absolutely honored to have you with us today. Thank you, ma'am.
Thank you, Sharon. Thank you to all the organizers.
Thank you, ma'am. With this, we have come to the end of today's session. I also like to remind you about tomorrow's session. Tomorrow's session will be taken by Dr. Fatma Kumari Singh, Professor of Social Science, Bangalore Central Campus Prize, deemed to be University. She will be dealing with the topic Emerging Trends in Positive Psychotherapy. Session will start sharp at 3:30 p.m. I thank everyone on behalf of Jyoti College. Thank you.
Thank you so much.
Thank you, ma'am.
Thank you, ma'am. Thank you, delegates, for joining with us today. Thank you.
And thank you, Dr. Sijo.
Thank you, madam. The session was worthy, and we are very grateful to have you on the dais for sharing your views with us.
Thank you, sir.
We are expecting for an offline platform for you. We are students and our faculties are waiting for your VC session from you. Thank you.
Okay, sir. Thank you.
Dear delegates, the feedback forms are provided in the chat box. Kindly fill it so that you may get the certificates at the end of the 5-day session. This is the live session, so the session will be available in our YouTube as well. So you can find it from our chat box in our WhatsApp. Thank you.